And across Kansas, this is KSN News 3 at noon.
Good afternoon. Thanks for joining us on this Wednesday. I'm Carly Willis. Coronavirus cases in Kansas continue to rise. The KDHE reports there are now 900 infected with the virus. Northeast Kansas continues to have the highest concentration of cases. Johnson County has 219 cases, while Wyandotte County has 192. Meanwhile, right here in Sedgwick County, we are reporting 134 cases. This morning, Sedgwick County commissioners unanimously approved hazard pay for first responders. The county is giving sheriff's deputies, firefighters, and corrections workers a $200 biweekly stipend. 911 dispatchers and emergency management personnel will get $100. We'll have more information tonight on KSN News at 5 and 6. This year, Easter Sunday will look a little different. Governor Laura Kelly expanded the state's stay-at-home order, limiting the number of people at religious services and funerals to 10. Kelly says she made the move after talking to church leaders across the state. She says most of them were already abiding by the governor's original stay-at-home order.
But there were a few that did not. And so we felt it in the best interest of all Kansans to ensure that what people were doing, mostly voluntarily, had to be done by all.
Many churches are turning to social media to broadcast their services live. Others have gotten creative by hosting drive-in type sermons. The Kansas Department of Labor receives an average of 520,000 attempted calls a day from people trying to file unemployment. Some of them are left unanswered. The state is now hoping to speed up this process to help the more than 70,000 unemployed Kansans. Secretary Delia Garcia says the state has 40 people answering unemployment calls, and they're training another 35.
We are just as frustrated that we wish we could move faster, but we will work with you. We will deliver on this, and you will get your paid money. We're just trying to work out some of the kinks on our system.
Secretary Garcia says the employees will be fully trained and ready to work this week. The only concern is getting them all laptops to work from home. Kansas has stepped up nursing home inspections after 4 elderly patients died in 2 major COVID-19 outbreaks just this week. But one state official says more needs to be done.
With each passing day, more ambulances arrive and the news becomes more grim. So far at this Kansas City, Kansas nursing home, 37 people have tested positive for the virus and 4 have died. So what's being done to protect the elderly?
Really, our focus all the time right now is really on that whole issue of infection control.
Laura Howard, the secretary of the Kansas Department of Aging, says her staff and federal monitors are inspecting nursing homes considered at high risk of infection, particularly the state's 6 nursing homes owned by Life Care, a company that has outbreaks across the country at its facilities. The first coronavirus death in Kansas was at a Life Care center in KCK. This week's outbreak in Burlington is also at a Life Care nursing home.
We're connecting with facilities, making sure they understand that guidance.
How to stop the spread. Starting late last week, federal regulators are now telling nursing home staff to wear masks. Even residents are now encouraged to wear them. If they don't have a mask, residents should put their hand up to block their face when staff approach them. But the best way to beat back the virus in nursing homes is to test more people.
That's what we need to be doing better. No doubt about that.
For example, after the outbreak in KCK, widespread testing here showed 4 staff had the virus, even though they didn't appear to be sick. It's believed staff may have spread the virus to residents. With more testing, infected people can be isolated quickly. The challenge, though, is to find the tests.
The number of cases of coronavirus in the United States continues to rise, topping 400,000 people infected, with states like New York surging to more than 140,000 cases. New Jersey also remains high at more than 44,000 people testing positive for COVID-19. More than 12,000 people have died from the virus, with nearly 2,000 of those dying between Tuesday and today. Prescriptions of hydroxychloroquine have spiked amid aggressive promotion by President Trump as a potential treatment for COVID-19. But even within the White House, opinions on the drug's efficiency are divided. Sarah Dolph has the story.
It's been repeatedly touted as a possible miracle treatment by the president.
With the chloroquine, I think the I think it could be something really incredible.
But top medical experts urge caution when it comes to treating COVID-19 patients with hydroxychloroquine, saying anecdotal overseas studies have been mixed. And the drug approved for treating malaria and lupus carries cardiovascular risks, among others.
No drug is completely safe. So particularly in very sick people, we must be careful.
Vanderbilt University is enrolling patients in a sweeping clinical trial of hydroxychloroquine to determine if it works and, if so, the most effective way to use it.
We're all looking for better treatments for COVID, and it's only through the use of these trials of several different kinds of treatment candidates that we'll find out what the best way forward is.
The American Medical Association urging coronavirus treatments be driven by science.
People trust their physicians because they know we do not act on whims or hunches or personal opinions. We take an oath to treat people ethically, and we go where the evidence leads.
The pressure for a proven treatment spiking, along with coronavirus cases. Sarah Dolph, NBC News.
California state investigators raided 3 different businesses, seizing stockpiles of medical masks. About 20 California Department of Justice officers were heading in and out of this warehouse. They seized thousands of N95 and surgical masks. The Attorney General's office has been cracking down on people they believe are price gouging during this current crisis. Legendary singer-songwriter John Prine died of the coronavirus. A representative for him says he died Tuesday at Vanderbilt Hospital in Nashville due to complications from the virus. The 73-year-old went to the hospital March 26th after suddenly developing symptoms. The Grammy Award winner suffered from several other health issues. Life is slowly taking on a semblance of normality in Wuhan today as Chinese authorities have lifted the 11-week lockdown, allowing residents to once again travel in and out of the city where the coronavirus pandemic began. Janice Mackey-Freyer reports from Beijing.
In Wuhan, a sense of freedom. At midnight, a light show to mark an end to the darkest days at the first epicenter of the pandemic. Sealed off from the world, highways have now reopened. Trains are rolling again. Families reuniting. 76 days of lockdown now over. Compare that to New York City, now on day 20 of a stay-at-home order. Though life for this city of 11 million people is still far from normal, social distancing is enforced, and to travel requires a green health code through a phone app that confirms a person is virus-free. But now there's at least a choice.
I think I never lose hope. I always think that there will be a day that all of this will end.
The revival of Wuhan will be closely watched as the virus that started here continues to spread across the world. Other governments taking harsh steps to contain it, measures Dr. May Bean believes are justified. He says Americans need to take it seriously, adding, just like in a war, people need to protect themselves. Officially, Wuhan recorded more than 50,000 cases of COVID-19 and more than 2,500 deaths, though the true scale of the epidemic remains unclear.
There are still restrictions in place in Wuhan and across China. There are millions of kids who still aren't in school. Here in Beijing, it's mandatory to wear masks, and you have your body temperature taken to do pretty much anything, including getting into your own home. The concern here is a second wave of infection. So while things are better than they were 76 days ago, there are no illusions that it's close to normal. Janice Mackey-Freyer, NBC News, Beijing.
Stay with KSN for our continuing coverage. We'll keep you updated on air and online at ksn.com. Senator Bernie Sanders has officially suspended his 2020 presidential campaign. Sanders made the announcement this morning saying that it was a, quote, difficult and painful decision. The Vermont senator was the only Democratic candidate left in the field challenging frontrunner Joe Biden. This pandemic can be scary if you have a compromised immune system, but imagine living in that fear every day. Well, that's the reality for one mother of a St. Jude patient. The precautions we're adopting right now is simply their way of life. Since July 2018, 4-year-old Olivia's family has kept hand sanitizer in every room, worn masks in public, and limited trips outside their home. Olivia has acute lymphoblastic leukemia and is immunocompromised because the chemotherapy she receives at St. Jude is wiping her system clean so she can have healthy blood. A simple infection could be detrimental to her young body. Her mother, Casey, says having no immune system is a scary, scary thing, especially now. And I'm thankful that Olivia is only 4 and does not understand how risky the world is for her. There is still time to support kids like Olivia through our St. Jude Dream Home giveaway. Your $100 ticket puts you in the running for the beautiful 2020 St. Jude Dream Home being built and finished up in Northeast Wichita. You might win the house, but you will make a difference for children like Olivia. All right, your weather is next.